Even as provinces and territories speak of peaking and plateauing and declining in this Omicron wave, there are still right now more than 1,000 Canadians currently in intensive care units with COVID-19. For many, leaving the ICU does not always mean a return to normal. Indeed, for some, the road to recovery is a long and difficult one. We're learning this morning more about the mental and physical challenges patients face. Karen Paul's reporting that some people are worried they don't have access to the supports they need.
Take your time, okay, if you need a rest.
As Anthony George sweats through his rehab sessions, he dreams about the things he did before he got COVID-19.
If I can get back on a bike someday, I'd be the happiest man in the world.
George was admitted to the ICU last June with shortness of breath. He spent 70 days on a ventilator being fed through a tube. He was resuscitated several times.
He also experienced a lot of ups and downs in the ICU and a lot of infections, actually. He had a rough go. He had a very rough go.
After getting out of the ICU, George spent another 2 months on the medicine and rehab units. He's still on oxygen.
I think when people hear that someone's out of ICU, they think, oh, good, they're good.
It's not done. That's the beginning of the journey.
I thought I could just hop on a bed and take off, eh? Yeah, I'm 53 years old, but I feel like I'm almost 70.
But it's not just the physical recovery. Some ICU patients report having mental health challenges too, because you're not the same person coming out as you were going in.
Sit. Good girl.
10 years ago, Nadine Foster's liver failed, sending her to ICU.
I have 6 weeks of memory loss.
The physical and mental health recovery took years for her and her young family.
Their mom almost dying and being in hospital, that's quite a response. And then, marriages suffer too. So my husband and I are no longer together. Yeah, just don't be surprised. The things that you will go through will shock you.
Research of Ontario patients found a 22% higher risk of suicide and 15% higher risk of self-harm among ICU survivors than other patients admitted to the hospital. The risks are highest for people between 18 and 34 and for those with a pre-existing mental illness.
We have to be prepared for when all of those things add up, that it could certainly lead to an increase in suicide and self-harm.
Anthony George knows his road to recovery will be long and complicated. He just hopes all the supports will be there when he needs them. Karen Pauls, CBC News, Sarnia.
So we want to give you another view inside the ICU now. Dr. Kwadwo Karamantang is with us in Ottawa, an ICU and palliative care physician there. He's been a guest on our network many times, and we thought this was the perfect opportunity to seek his perspective again. So good morning, doctor, and welcome back.
Thank you so much for having me, Heather.
You were listening there to Karen's report, and I'm wondering if what she was talking about struck a chord for you.
Absolutely. It really breaks my heart hearing these stories. And this is why we make such a valiant effort to try and prevent ICU admissions. We're in the pandemic now, and why so many of us have been advocating for vaccinations and all the treatments necessary to prevent an ICU admission, because it's not easy. And we see it every day that if you survive your illness, the rehabilitation, the impact on your mental health and physical health. I was part of that study with Dr. Fernando, in terms of the PTSD, anxiety, depression that we see post ICU discharge. And this is why we really are pushing for trying to get preventing patients from landing.
Right.
And honestly, there's more and more efforts amongst our critical care community to try and rehabilitate patients as soon as they walk in the door, getting them active, getting them moving, reducing the amount of sedation that they're receiving so that we can prevent them from getting all these complications.
So you make quite a case for, you want to avoid going to the hospital at all costs and using all of the measures that we know. But from your own experience in your own ICU atmosphere, can you just speak to, what we heard in Karen's report from the doctor to whom she spoke, leaving ICU is really just the beginning. What are you seeing as far as the state and the degree of impairment from people leaving the ICU?
Yeah, it's a great question, Heather. And you know, when we often don't get to see the road to recovery, but we certainly see when they leave us, there's still a lot of work to do. Like often patients have, and specifically when it comes to COVID, you know, there are high levels of oxygen needs. Sometimes they'll have to go home on oxygen. The amount of weakness is significant. Like the ability to walk, feed themselves, might not be present. You know, and so like, and then also, you know, the mental health aspects. You know, we often see patients that are delirious during their admission, but often this could be associated with anxiety, depression, post-traumatic stress, and so we do our best to mitigate these things, but we fully acknowledge that once they leave the ICU, there's still much more of a journey ahead. And so, you know, like I said, we do our best to try and mitigate this, but it's a challenge.
But what you've talked about there, those are impairments that have long duration, long impact on someone when they leave. In terms of post-ICU support, what's your assessment of what's available?
Yeah, you know, this is a great question. I know locally we have excellent rehabilitation centers, you know, for patients. I think this is something that we got to think about moving forward, though, Heather. Like I think with an aging population, with what we've seen through COVID, we do need to think proactively about the needs of the public. And one of the things that, you know, our research group has been talking about is, you know, maybe can some of this be done virtually, for example, take advantage of all the investment in virtual care that's been happening throughout the country and our province, to be able to reach out to as many Canadians and people that need that support. But certainly I think collectively we need to think about the needs, because I think it's only going to get higher as baby boomers reach peak medical resource use. So there'll be some work need to be done.
You know, I wonder what your thoughts are then, given what you've just talked about, the reality, the message to try to do whatever you need to do to avoid having to go to hospital. Governments are talking now about lifting all restrictions. Polling is indicating that Canadians have had it and they really want to end restrictions and live with it, and live with COVID, I guess, is the assessment, the wish. What is your message then at this time?
Yeah, I would say a few things. So, Heather, I think personally, my opinion that we're ready to start with that approach of living with COVID, because, you know, there's COVID, but we also see the impacts of some of the restrictions when it comes to delayed cancer diagnosis, mental health, the overdoses, the complications from substance abuse. So that, you know, we need to think of health holistically always, and I think we're at the stage where, you know, luckily, Omicron seems to be, in terms of hospitalizations, has peaked, and we got the luxury of seeing other countries that have opened up and that are doing so successfully. And I think to mitigate that, we really need to look at who's at risk of landing in ICU and make sure they get their first, second, third doses. We got to make sure they have monoclonal antibodies and other therapeutics available, Paxlovid, for example, fluvoxamine. Like, we've got to make sure that we can provide patients that are at high risk with all the necessary means to avoid ICU admissions. But at the same time, we also got to think about what the restrictions have done to other areas of health. Like, you know, when I think of our youth, when you think of their mental health, their physical health, the ability to socialize, like all that, if we don't address that, they are future ICU patients, to be honest with you. Like, this is where we see that common thread. And so I think, you know, it's not an easy answer, but I think collectively the approach of learning to live with it is a must.
It's not an easy one, but it's a very nuanced answer. I appreciate the perspective. Open up, but not without those supports necessary and all of the key resources that you mentioned and the treatments and therapies available to us right now at this point in the pandemic. Thank you, as always, for giving us some time and sharing your insights. I appreciate it.
Thank you so much, Heather.
Dr. Kwadwo Karamanteg from Ottawa with us this morning.